It's Monday, and that means it's time for a new episode of Interviewing People, the careercast where you can learn about a variety of careers from people actually doing the work. Today I'll be talking with Kristin Conner, who once walked these halls, but is now a registered nurse in the Coronary Care Unit at Blanchard Valley Health System. Kristin will be sharing about what she does as a nurse, advice she has for future nurses, and much more. So enjoy the show. Hello and welcome back to the Interviewing People Careercast. And today we have Kristin Conner with us. She is a 2015 Van Buren graduate, and she is currently working as a nurse at Blanchard Valley Health System. And she's going to tell us a little bit about her experience becoming a nurse and what that has meant for her on her career path. So Kristin, thank you very much for joining us. And I'd love to hear a little bit about when you were graduating from high school. Were you thinking that you were going to become a nurse? What was your plan at that time?
I did not have a plan at that time. I always thought that nursing was just a 2-year degree and I wanted to get a 4-year degree. I always thought about taking care of people and like making a difference somehow, but I just didn't know how yet. And when I went to college, I found out that nursing was a 4-year degree, so that's why I went into it. If I had known in high school, I probably would have chose it then, but I didn't, and I'm glad I do now.
So what were you thinking you were going to study when you went to college?
I have no idea. I went in as an undecided major and was put into a career development class that helped me figure out what type of careers match my personality best. And I basically looked into anything that was health professions related. I basically looked just at like nursing and athletic directing for a little bit, but nursing ultimately felt the best to me.
So you graduated from the University of Findlay, and you have some letters after your name, BSN, RN. Can you explain a little bit about what those mean? Are those the only options for nursing? How does all of that work?
So BSN stands for Bachelor's of Science in Nursing. It's very different from just a Bachelor's of Science. That's just like the 4-year degree in getting like your actual like diploma from the university. RN is registered nurse, so that is my license where I had to take a test outside of school to get my license to practice nursing. Still become a licensed practical nurse, which is a LPN. But they're kind of trying to get rid of that in a sense because there's more of a need for registered nurses than there is for LPNs. And then you can also not get a bachelor's degree for nursing. You can get a what's it called, like ADN or something like that, associate's degree in nursing, which is just the 2-year degree. And then you can also further, obviously, get your master's and doctorate as well, which I didn't know there was a doctorate in nursing, but apparently there is. Haven't completely thought about it, but it's definitely a possibility. And there's also different like credentials that you can get as a nurse too. Like I know you can get chemo certified, you can get trauma certified, pediatric certified, just a bunch of different specialties with it.
That associate's degree or 2-year degree, what does having a bachelor's degree allow you to do that having an associate's degree wouldn't allow?
There's really not a big difference. What I was always taught is with the bachelor's, you'll take an extra class in leadership, which allows you to become like an educator or manager of some sort. Whereas as an associate's degree, I don't think you can really do that. I know that it's happened before, but they try to like shy away from that.
Okay, that makes sense. So you currently work as a coronary care nurse.
Yes.
And what does that mean? And what does a typical day for you, or how does a typical day for you look?
So coronary care just means heart related. I take everything and anything under the sun that's anything related to heart. So like congestive heart failure, arrhythmias, cardiac arrest, dilated heart. So our unit is also not just like heart specific, it's critical care as well. So we'll take the really sick heart patients, but then we also get like intensive care overflows as well because we have the capability of taking care of them as well. We also take a lot of open heart patients, ones that get completely split open in their chest and have something done to their heart. So we take pretty much everything under the sun. but we're trying to be specific to mainly heart stuff.
Now, do you ever go into the operating room and you're in there when that's happening, or are you more care after an open heart surgery? How does that work?
We're more care for after. I mean, there's probably a way that I could get into the surgery, but I'd have to apply for a completely separate position. Plus, I'm not really a surgery person, so I wasn't interested in going that route. But we do the recovery of that patient and then the aftercare of them.
How long is a patient, in a best case scenario, how long is a patient in the hospital after open heart surgery?
Typically, best case is like 4 to 6 days, but sometimes I'd say most common it's like 7 days.
Okay. Okay. Well, that's amazing that you can literally have your body opened up and 7 days later be headed home. So I guess
Well, they
that's
don't really head home. They go
oh,
home usually for some type of rehab.
okay. Okay. That makes sense. Okay. But again, speaks a lot to, I think, the care they get that they're able to even do that.
Hmm.
So as you think about your career working at the hospital, obviously we know that nurses are in hospitals, they're in doctors' offices. Are there other opportunities for nurses to work as a nurse other than in a hospital or in a doctor's office?
Yeah, so one of the classes that I had to do in college was community health. It actually showed us different places that you can work at as a nurse. Like you can do home health and you can work in a school system or even a jail. And then you can also work at like a chemo center, which is kind of like a doctor's office, I guess, but there are definitely other places too. I don't know every single place because I didn't go to every place, but I do know of those other options as well.
Did you have a choice between any of those and working at the hospital, or did the hospital opportunity open and that's just where you ended up going?
I had a choice. I wasn't interested in going to a doctor's office just yet. I really liked the hospital setting during my clinicals. So I chose to do the hospital setting, whereas one of my coworkers went straight to a cancer center and started doing it there rather than go to the hospital first.
Interesting. So as you think about your job or career as a nurse, obviously there have to be some good parts, there have to be some very difficult parts. Can you share a little bit about each of those, what you do really enjoy, and then what are some of those difficult parts that someone wanting to become a nurse should be aware of before heading down that path?
So I can speak of two things that just happened recently that are both ends of the spectrum. Like we currently have a patient without giving out information that has been in the hospital for a very, very long time, which is very abnormal. And it was touch and go for quite a long time. But right now, this patient is on an upward trend and just showing so much improvement that just the other day when I was talking about it, it brought so much joy to me and made me want to cry tears of joy. And anytime that this patient did stuff that I was just shocked at because they weren't supposed to, I would just go brag about it to my coworkers. So you do get to form a connection with these patients if they are there for a long time in the hospital and plus also at nursing homes. So seeing them get better and improve is just the greatest part of being a nurse. But then on the downside is when you make connections with these patients and things don't go the way they're supposed to, you are sometimes unable to separate your feelings from the job. So then it's hard when you lose patients. It's hard when things just don't go your way. Like a patient I had last night was doing super, super well. And then all of a sudden it was just, nope, not going to do so well anymore. And it just was a really stressful time to be in. And so that's one of the downsides of being a nurse.
Thinking about that stress, do they talk to you about that in school as far as how to deal with that? Do they provide services to help nurses deal with the life and death situations that they deal with daily?
They taught us about it in school. Obviously, we didn't understand of it because we weren't like feeling it. They always said, yeah, it's going to be a high stress, but like me going, oh yeah, high stress, I can handle it. But then you get into it, it's like, oh, okay. And so they didn't really teach us how to handle it other than just try to separate it. Like, this is your job. Like you obviously are a caring person to go into nursing, but try to separate it at some point because you don't want to get too attached. Regarding stress in the actual work field, like right now it's nurses week. So they've been giving us a lot of special treats and offering a lot of discounts for us at places. So, I mean, they offer stuff year round, like spot leave. They don't do it all the time, but like during this week, they're doing it all the time. So there is ways to handle the stress. It's just not as much as maybe they should be doing right now, but that's just kind of the world we live in. And I think it's working on bettering that right now anyways.
Right. As you think about COVID, we know that a lot of businesses in all organizations are looking for employees, and I know healthcare is no different, and you have worked like crazy for the last 2 years, I am sure. What does the job outlook look like for nurses? If a student wanted to go into nursing, will it be easy to find a job? Are there any certain things they should be considering as they prepare for going into that career?
Highest demand right now is definitely in the hospital and the nursing home setting. So not as much in like a private doctor's office or just a little area like a school necessarily. There's definitely not a high demand for nurses in schools. But there will not be a struggle to find a job, especially in the hospital or nursing home right now. And I mean, I think students should expect to apply to several different jobs so that way you have more than one opportunity, because there's going to be a lot of people applying for these, but you'll always have at least that one opportunity to get a job. And I can't say there's anything specific that you would do to increase your chances other than like do good at school and just make sure you get a lot of experiences while you're in school as well.
Good. As you think about, is there one big idea or big thing that a student should be considering before making that decision to go into nursing?
I know that a lot of people went into nursing originally because they thought it was going to be easy. And if someone is thinking that, they're absolutely wrong. Schooling is hard. Nursing is hard. If you don't have a care for people and you don't have that drive to make people better, then nursing is not the career for you. I know several coworkers that thought it was going to be easy, and coming into the pandemic, it probably messed up their way of thinking, but they don't have that drive anymore. And they wish that they didn't go into nursing. I am fortunate enough that I don't have that regret, but if people have any sense of like second guessing or questioning their choice in nursing, then don't do it.
That's definitely one of those reasons why it is so important for students to get experience. And we have our Beyond VB internship program now that we're hoping to get students out into the workplace so that they can make those decisions before they go spend that money and so forth. So yes, I definitely think experience is huge. So if we think about, or if you think about yourself in high school and you look at where you are today, is there anything that you know now, either about careers or just life in general, that you wish you would have recognized or known when you were in high school?
No, I mean, I think that having that caring attitude in high school, like just applying it to animals, like really kind of showed me that like I was like how caring I was, but I didn't know how to relay it. So I guess I wish then like having that caring type of personality was the type of personality that would fit best in a healthcare setting. And I think maybe also maybe having more of an opportunity in high school to like volunteer or work in some type of profession where I'm getting to interact with people and take care of them would have been helpful too. I didn't get into a healthcare job until I was a sophomore in college, which even though I started off in just like the dietary, I still got to see a lot of people, but I think maybe starting that earlier would have helped me even just further along and put me further than where I am right now.
So again, going back to that experience, how important that is.
Yeah.
Good. Well, Kristin, I really appreciate all of this information. I appreciate you sharing about your career path. I appreciate all that you and other nurses have done throughout COVID. My mother-in-law is a nurse, so I know what all of you have gone through with that. So I really appreciate this, and I hope that maybe some students will reach out and ask you some more questions if they have those. So I greatly appreciate it, and thank you for your time.
Yeah, no problem.
Thank you for watching this interview with registered nurse Kristin Conner. I hope you learned valuable information from her career story, and to be sure you don't miss upcoming interviews, please click subscribe so you'll know when the next episode is released. Thank you for watching, and as always, remember the best part about Mondays is interviewing people.